Hello everyone and welcome to a very special episode on TREAT, the online channel for doctors created by The Altered Doctor. And today we are here to talk about a very important topic. We all know of the enormous risk being taken by doctors, nurses, paramedics and other members of the healthcare fraternity when treating patients with corona. While there's a lot of talk about the transmissibility of the virus, HCQS prophylaxis, personal protective equipment, there's very little being talked about the mental health of the healthcare providers in the times of corona. What are the mental health challenges faced by the healthcare provider in the times of a pandemic, and what can be done to combat these challenges? Well, to answer these and much more, it is my fortune to be joined by a very illustrious personality. He has been the past president of the Indian Psychiatric Society. He has also been a theatre and literary enthusiast. It is my privilege to introduce you to Dr. Ajit Bhide. So much for joining us today, sir.
Honored and delighted to be here, Nitin.
So let's just start off. You have had experience before in dealing with mental health of healthcare workers, albeit in a different situation in times of mass disasters such as the Bhopal gas tragedy or tsunami. How different do you think, and if I may add, how difficult it is going to be this time in dealing with the mental health of healthcare professionals? If you can sort of give an overview of what are the challenges that we could expect.
Well, the whole realm of disaster mental health is a tapestry of varied hues. Now, the commonality with other mass tragedies is that you're dealing with a huge number of casualties, and these casualties come in waves. A huge number, then it suddenly tends to fall a little, and then another wave comes, and so forth. And this is common to all disasters almost always, except those that hit in one stroke, like a tsunami. In tsunami, it happens only once. But here, the huge difference is that you are directly in danger, because the important element here is infection. Now, the patients who come to you are there because they have been infected, and you run the risk of picking up the infection. Now, that is not something that happens, for example, in the Bhopal gas tragedy, it didn't happen. In the tsunami, it didn't happen. In the railway accidents that we have catered to at our hospital, it didn't happen. Here, you run a risk to your own life, physically speaking. And then the mental realm, there are certain commonalities and certain very major differences. The commonality is that you are burdened with work, and you're seeing death all around you. You're seeing potential mortality around you, and that is quite to use a simple word, frightening. But over here, what happens is that you have to personally protect yourself. You have to try and ensure that you are guarding yourself adequately so that you're available to give aid to as many people as possible. And that's the difference between the two.
All right. So I just would like to take up on that point of yours. And we have this study coming in from China, where they looked at the sort of mental health challenges which would be faced by healthcare workers. And they say that depression was found in 50.4% of the healthcare workers, anxiety in 44.6%, insomnia in 34%. And again, secondary hospitals sort of had more of these than tertiary care hospitals. Now, what is your view on this sort of distribution of the challenges which are being faced? Do you really expect to see a lot of depression as compared to anxiety and insomnia during these times?
First of all, I'd like to say that there's a huge overlap between the three. These are not to be considered individual categories that do not overlap. For example, you'll hardly ever get depression without an element of anxiety. On the other hand, you'll have quite a few people who are anxious, but will not go into depression. Now, generally, in the short run, anxiety is the immediate response. Anxiety will naturally flare up. It's the standard stress response of fight and I always say between flight and fight, there is a preceding F that is fright. So that fright is the anxiety. And the anxiety will then give rise to a response. Here, of course, you're fighting. You're not fighting the fight is against the infection, and you have to guard yourself adequately. Very few healthcare workers will take recourse to the other F, that is flight. There is no reason they would do that, because they're dedicated people who are working in this field. Nevertheless, to put yourself through the fire of exposing yourself to this infection, you are going to be highly anxious. Upon anxiety that goes on and on for some time, and when you see a lot of morbidity around you, more than morbidity, the mortality around you, that is disheartening. Because somewhere, every healthcare worker feels when a patient dies that he has failed or she has failed in some way. This happens a lot to nurses who work in ICUs, for instance. And now, with the burden of with the number of patients increasing so rapidly, this is exponentially increased. Anxiety is the primary first response. Depression is something that ensues after some time. Now, because you have a disturbed work schedule, your biological rhythms really go haywire, and that's why insomnia comes in. Insomnia also comes in as an accompaniment of anxiety. All of us know that when we are highly anxious, we do find it difficult to sleep. Insomnia is much more marked when anxiety has gone on into depression. And the kind of insomnia that accompanies depression is much more fatiguing. One more F for you over there. Work fatigue is something that sets in because you're continuously there looking after patients. You have to have a sense of priorities, what they call triage, and who gets attention first, who can be put a little on the, so to say, no pun intended, back burner, because it is a burning problem that we're dealing with over here. So prioritizing within that, there has to be a team hierarchy, and then sometimes, you know, the boss is not necessarily taking the right decision. So your communication skills come into play. All these factors burden the mind, and that leads to the burden of psychological problems among healthcare workers.
So in that sense, do you think that, I think for the first time, apart from a pandemic, the mankind has to deal with something like an infodemic? I mean, there is just...
That's an interesting word.
There is just a tremendous amount of information. You've got social media, you have the WhatsApp University forwards, and terms such as COVIDiot, and, you know, certain obsession with numbers. Do you think that all these factors of essentially social media is playing a big role in causing a spike in the mental health challenge?
It contributes, without a doubt. It contributes, and it's a not an enviable situation, let me say, because you are so anxious. You want more information. You want to know how much of a risk is there in your personal life, and naturally you're going to be burdened by that thought, and you will find it difficult not to engage in the inputs from the media. You want to know what is the mortality rate currently, what is the government doing about it, how much of the measures are reaching the right people. We also have the notion that this illness is killing much more in countries where the economy is very strong compared to the countries where the economy is very weak. But that is not the entire truth. We, through the media, realize that testing is of great importance. The medical fraternity knew about it. People were not aware of it. And they were glorying in the idea that in this country, the incidence and prevalence of COVID is quite low. And we were out beating drums and bursting crackers a little prematurely, in my opinion. So social media, on the one hand, is the most important information giver for you. On the other hand, it can garner, it can create, it can exacerbate a lot of panic. And there we have to be very, very careful. Social media, there's everything from COVID is fake. There is a whole site which calls itself COVID is fake, going on to saying that this is the end of the world. Somewhere in between, we have to find a via media that's cliched, but it's still rich with meaning.
So we have a lot of training videos on how to don the PPEs, management of COVID per se, and many other things which are looking at the actual medical aspect. Do you think it's high time that the government and institutes enforce that a psychiatrist or a psychologist also is part of the COVID team?
No doubt. No doubt. Psychiatrist, let's say a mental health professional, a senior enough mental health professional, and I will not belittle the role of clinical psychologists. Some clinical psychologists do a very good job, and they know when to call in a psychiatrist if medical psychiatric intervention is, psychological intervention is necessary. They function as healthcare givers in terms of mental health, and they also serve as ombudsmen on every team. So I think it's worth having a mental health professional in any COVID emergency care team.
So how do you propose that this is done? So for example, do you think that there should be sort of a questionnaire where there is self-reporting, a sort of a screening questionnaire, or do you think that at the end of every week of duty, you have a debrief with the mental health professional?
Both could be, and they're not mutually exclusive to begin with. Both models can work in tandem, and that's the way I would like to go. Mental mobility is gauged through questionnaires. There's no lab test or stethoscope elicitable sign with mental mobility. So we have to rely on questionnaires.
So in specific, if we were to talk about the healthcare workers who are indulged in the frontline treatment of COVID as such, what are sort of interventions which can be done by institutes, the government? Because sometimes it's just an opinion that as a healthcare professional, you might actually find it difficult to step out and say that I am having a problem, I am facing anxiety, because then you might undergo the stigma that you're being weak or you're not equipped to cope with something like that. So do you think sort of having a mandatory debrief with a mental health profession at a regular interval, maybe a week, maybe 2 weeks, and at 2 weeks interval would be the way forward?
I couldn't agree more. I would specify it at where it's possible every week. Where it's not possible, at least once in 2 weeks, that debriefing is absolutely mandatory. And we must fight we are continuously in this profession fighting stigma. We must fight this notion that these people are weak in any way, or weaklings of some kind because they couldn't cope with it, because the burden is huge. The burden is huge, and the possibility of death is continuously looming over you. There's just no denying it. I will grant that some people tend to overreact. The ability to endure stress varies from individual to individual. But to think that these people who are facing possible death are overreacting is really something totally uncalled for and to be avoided.
So in your opinion, if you could suggest to the government and to the institutes certain measures to be taken, A, in the short term, and B, in the long term, to even monitor for things like post-traumatic stress disorder, or just to keep on a regular follow-up even after the pandemic sort of settles down?
Yes, the debriefing that you referred to and that I endorsed is something that needs to go on as an ongoing process. And if somebody has not had symptoms of anxiety, depression, insomnia in the beginning, it doesn't mean they won't arise later. In fact, that is what PTSD is all about. After the stress has really passed on, something lingers inside you, and the unfortunate thing is it can grow. You can have flashbacks. You can have these flashbacks are recalling of memories either in your wakeful state or much more likely in your dreams of the horrible things that you had endured. These people see death all around them, and that can be a horrible experience for anybody. And it is something which is generally treatable with a combination of psychosocial interventions and in some cases medication as well. And for that, you need this follow-up fairly regularly. This pandemic, I don't think is going to go away in a hurry, though we are trying very hard to bring it under control. I don't think we are going to be free of this stress for at least another 3 months. Long haul to go. And so we must engage in regular follow-up and have a mental health education system available that other health professionals can go through. Confidentiality becomes an issue because much as we may want to fight stigma, it is belittling in the eyes of many others that people have had some sort of different degrees of mental breakdown, and that needs careful monitoring and careful handling. So I would think the mental health professional should be available around the clock to patients, but also to health caregivers, and be available in a confidential setup where they can come and spend the time they need to unburden themselves, so to say, and the debriefing, I love that word, at a suitably scheduled time and place. One thing that happens is people are burdened with a lack of time, and time management becomes tremendously important over here. Mental health care calls for adequate time. Things done in a rush well-intentioned though they may be, can lead to worse consequences than would have otherwise ensued.
Are you aware of any interventions which are being done in any other countries or institutes as such in the short term when the pandemic is still going on to sort of keep the spirits up of the healthcare personnel who are working in the institutes, or sort of anything like a positive reinforcement or something like that?
In the Scandinavian countries, I know this goes on quite well, and I understand from my reading that it's happening even now, that they have recreational activity. Most important over here is the recuperation time we give to our healthcare professionals. Our young doctors, leave alone the COVID situation, our young doctors, resident doctors who are doing their post-graduation, young consultants who are on call, do not even get 24 hours off every week. I have been writing to the health ministry and to the PMO saying that every doctor should get 24 hours off in a week. Now, in a situation like this becomes even more important. Of course, I don't expect people to be able to take 24 hours off in a week right now, but had we geared our system to have this recuperation period, everybody needs time to recharge their cells. If you don't recharge your battery, you're not going to be able to function efficiently beyond a point, and you may even have an actual breakdown. The burnout can ensue, and that is something that is so very preventable. So I think the government should have mental health professionals on their team. B, see that mental health professional expertise is used as an ombudsperson as well as a actual health consultant for the mental health, for the healthcare professionals, sorry, not the mental health care professionals. And from time to time, there should be recreational activities that can help people unwind before they can get back to work. All right. Family time is very important. Family time is again laced with this fact that the family is going to be anxious about this person who comes back from having done hospital duty. And I have 2 or 3 instances of this where the family gets very anxious about, hey, we want him back with us, but is he going to bring infection over here? And that becomes a dicey situation. So keeping the distance is important, no doubt, but keeping the distance within limits. All right, so that's important, and the government should ensure this. I really think our young doctors need enough breaks to function more efficiently.
So I think someone had posted on the social media again that it's important to maintain social distancing, but not emotional distancing as such.
So, very true. And another person, a theater friend of mine, has posted that, why are we calling it social distancing? It's physical distancing. And I think that subtly implies what you said just now, that it should be no emotional distancing while we do speak of social distancing.
So just to summarize whatever we have discussed so far, mental health care professionals should be mandatorily part of the COVID team. Second, there should be sort of mental health education which needs to be done for all healthcare professionals, especially those involved in the care of COVID-19 or suspect patients. Have enough rotation of duties to give sufficient time to recuperate, have screening questionnaires,
Right.
Have screening questionnaires or debriefing done at regular intervals, and more importantly, have a long-term follow-up mechanism to sort of screen for PTSD.
Yes, not only PTSD, it need not necessarily be PTSD, so that's the one to watch out for. Even depression ensues upon stressful periods, and it may not have all the features of PTSD per se. Depression ensues quite commonly, and it was shown that even suicide among healthcare professionals after a major disaster has passed is quite well known. We should guard against it.
All right. So to close this wonderful discussion, would you
also one more thing I would guard against? Let me say not guard against, but we should do preventive work for is substance abuse. Drinking goes up quite a lot. We know that doctors are at a greater risk for alcoholism, for instance, and substance abuse, and that happens because they need something to recharge their cells, to drown their hang-ups and hassles that come with a stressful job like being in ICU all the time. This is something we should educate healthcare professionals about, and minimize the intake of alcohol and other substances of abuse.
I think that's a very important point which has been brought out, because that's something sort of not really coming out even from the Western articles or papers as of now. So to conclude this wonderful discussion that we have had, what would your advice to be to healthcare professionals in this point of time to sort of look after themselves, their mental health, and be fit and fine to function in an effective manner?
Before advice, I would metaphorically take my hat off to them. So hats off to these wonderful people who are facing, who are our frontline fighters of this scourge. Noah Hariri, what's his name? Noah Hariri recently made the point that don't treat this like a war. And he made a very spirited defense of that position. I will say that whether it's a war or not, it's definitely a fight against a scourge. And to put yourself at risk over there is something very noble that you're doing, very selfless that you're doing. And don't ever, this may not be happening at all, but I'd say don't ever give up. We depend on you quite a lot. In terms of guarding against anxiety, depression, insomnia, which emerged as the most important psychopathologies among healthcare workers, I'd say take enough time off, and those who are in a position at the top of the hierarchical position, make sure that your communication skills within the team are adequately diplomatic, adequately honest, adequately urgent, without being too much in a hurry. So in that context, have regular gatherings where you debrief not only about mental health, but about general health situations. Ensure that you get enough time to recuperate before you're back on duty, and that will recharge your cells adequately. If you have stuff that is bothering you, weighing you down on your minds, do not hesitate to reach out to a mental health professional who will be sufficiently confident, sufficiently competent, and mindful of ethical considerations like confidentiality. Most of us are well trained in this, and we need to be part of this team.
With that, thank you so much, Dr. Ajit Bhide, for joining us on this wonderful discussion. We really hope that government and institutes across the country take forward these suggestions, and not just PPE, even mental health care of healthcare professionals is not neglected and is looked after. Thank you so much for joining us on this discussion.
Delighted to be here, as I said, and I am sure that your important message about mental health care as a part of COVID emergency care will carry. Thank you.
Thank you so much. With that, we come to the end of this episode. We thank Dr. Ajit Bhide again for graciously spending his time to discuss the aspects of mental health faced by healthcare providers in the times of Corona. We hope you're staying safe and staying healthy. If you have any feedback, please drop in the comments. If you like this video, please do share, and please do subscribe to our YouTube channel, TREAT4DOCTORS. You can also follow us on Facebook at facebook.com/TREAT4DOCTORS. Until next episode, this is your host, Dr. Nitin Yashas, saying goodbye.